go out into different villages. Actually, on 2 occasions we've seen patients here, but we go out into villages as far as 2 hours away and see local patients who just walk over with various complaints. Most of these people haven't seen any sort of medical provider in months, 2 years, or occasionally a lifetime. We have a total of 5 faculty here: Dr. Hutchins, myself, Shakara Lynn, who is a nurse practitioner. Actually, she's not faculty, but she's helping us out. Grace Lewis, who is with the School of Nursing, professor with the School of Nursing. And Dr. Jose Pino, who is with the College of Liberal Arts and is a translator.
We saw in 9 clinic days, we saw about 690 patients on average, which is about 70 to 80 patients a day. On our busiest day, we saw 111 patients, so it was a lot busier.
I'm so proud of everybody, not only my Spanish students, the team of the interpreters, but also the medical ones, the pharmacy students, the nursing, and the undergraduate. This interdisciplinary group worked really well.
We really had to pull together as a team across multiple disciplines and help others, and we helped ourselves, I think, in the process.
I think this group has been wonderful, and this year I think has been one of the best I've ever been on.
So this is the same thing for the boy?
The ongoing interaction between Mercer, HOI, and Honduras, I think, has significantly benefited the population, but there is a huge, there's a very long way to go.
This trip should definitely be continued. I can see how people could be skeptical, a 2-week mission trip, what does it really do? But HOI does, I mentioned it earlier, they do a lot for the people here, and it's a lasting relationship. So I don't feel like it's a waste treating these people for long-term conditions, because of the confidence I have in the organization that we're working with.
I think health is one of the biggest needs that we have in Honduras, and Mercer comes to do like a lot. I mean, I know we know we're never gonna pay you what you guys do over here, because you come and do a lot of like a big service. So I think that you guys make a big difference coming. So why not? You guys keep coming anytime you want.
La comunidad es una comunidad de pocos recursos.
We are a very poor community. We have no way to go to a private clinic. That is why we thank God for you. We are always praying for you, for what you come here to do in our country.
I hope that the experience gives the students, lets them realize how lucky they are, by accident of birth, to have been born and grown up in the United States. And I hope they can appreciate better. I hope we all can appreciate better what we have.
People are really amazing people, thankful people. Even though they have so little, they feel like they have so much. So I think it's going to teach me a lot about the cultural differences that patients kind of bring in.
I've learned a lot from the medical students and the pharmacy students, and I feel like the biggest thing I'm going to take home with me is just like being able to work with other healthcare professionals. So I feel like in the beginning it was kind of a power struggle, because we all wanted to show that like we knew what we were doing, and we didn't really know like how we all fit together. But by the end of it, we just had so much respect for each other and for each other's careers. So I feel like I'm going to be able to take that home, and when I'm working in America, instead of trying to prove myself, it's going to be easier to work alongside as a team with other professionals in healthcare.
I think this trip affects students in a number of ways. One, I think it helps them be more confident. I'm here without a pharmacist above me. There's no one checking what I do, and that's not normal. So that's been kind of a scary experience, but also freeing at the same time, wondering if this was right or not. But I think also just the team we have here has been great, and I think many of the people on the trip will have made me a better pharmacist and person in the future.
Before this trip, I was unsure about if I wanted to go to pharmacy school or medical school, but after this trip, I'm pretty sure I want to go to medical school. I'd never traveled out of the country, so I'm not very cultured. I feel like I know a lot more about like poverty in the world, so it's really different to see other people like they can't go to the doctor if they need to go to the doctor. Like I kind of understand a little more what some people go through. And I think that's like a good experience for me to have as I enter into the healthcare field.
I just hope I can be more like the people here and just relax and be happy and easygoing and know that, you know, God's taking care of me and is obviously giving me everything and more.
I heard my first heart murmur through a stethoscope, and that was really cool. When you hear it, it was like everything just stopped and I could only hear the heart and the murmur, and I couldn't stop smiling after that, and that just made me feel like this is definitely what I should be doing in the future, and I want to use my Spanish, my medical Spanish vocabulary in my occupation when I'm older.
Very gently.
We've had some patients come back because they knew Mercer was coming. Somebody came to walked 4 hours today to see Shakara because she'd seen her last year. And she walked 4 hours each way, so she's probably still walking to get home. So these people, you know, remember us, and so I really do feel like we're making a difference. And I feel for the students and even the faculty who've never been at a place like this, it's important that you come and just see what life is like here.
Abre mis ojos, oh Cristo, abre mis ojos, te pido, yo quiero ver.